Yeah, hello and welcome back. We are a bit delayed, but I hope that you stay with us and you're as curious as I am to hear from Bleddyn Rees, the chair of the Digital Health Society and the vice chair of the European Connected Health Alliance Group, about the societal compact. So this goes under the topic of the health data sharing. It's also, I think, the session that we had before on the vaccination record already brought us a bit in the mood, in the context. But here in this short fireside chat, I would like to ask Bleddyn to tell us what is the societal compact. Maybe some of you heard about this already. For some of you, this might be a new concept. And of course, then we want to learn how to best promote the development and the adoption of a European multi-stakeholder compact regarding responsible data use, transparency, accountability, and communication, how this kind of compact could work to fulfill the goals of the European health data space at a faster pace. And generally, we will also touch on the results of the Digital Health Society roundtables that we already mentioned. So, Bleddyn, welcome to this fireside chat, and maybe let's just go straight to the issue. What can you tell us? What is this societal compact? What is it all about?
So about 2.5 years ago now, we started the roundtables, and then one of them was looking at, so how could we increase access to health data, use and reuse? So if you like, that was the $64,000 question. And Roundtable 3 started to look at the idea of this compact. And essentially what a compact is a voluntary agreement between stakeholders, and in this case, people who have data that people can access, and people who want to use that data. So whether that's researchers, whether it's industry trying to develop new drugs, new medical devices, deliver new services, or indeed public organizations. So the concept, okay, dates back a number of centuries in terms of that society used to collaborate together in order to achieve a common purpose, a society benefit. An example might be, think hundreds of years ago, farmers needed to go to market with their animals. And what they did is they started to club together to run and operate abattoirs. That wasn't their core business, but it was an integral part of needing to generate revenue. So the idea is not new. It's in some ways an old idea that we're repurposing to a modern way. So that idea came out of a working group discussion in Roundtable 3, and then we started to develop more detail around it, which I'm happy to expand on in different ways. But the basic concept is a voluntary agreement. And I guess it's worth saying that this could be relatively small. So it could be between one data source and one user, or it could be, as we preferred, the idea that this is a big compact. So it's multiple parties. So the sort of organizations, for instance, that could be involved in this are substantial. I mean, they could be public bodies who have registry access. It could be pharmaceutical companies, med tech companies, patient organizations, hospitals. It could be organizations that have consumer data, population information. So very, very broad, if that makes sense to you.
Mm-hmm. And tell me, why do we need this voluntary agreement? Can't we just solve it with some international level or national level?
So if you try to do it at member state level and across borders, that would be ideal if you could do it. But the length of time that it takes to do this, in some ways, this type of an arrangement is what lawyers would call soft law, a bit like codes of conduct, much easier to develop quickly, and also to keep pace with technology developments in terms of security and privacy. And also we felt that this is not competing with, for instance, the European health data space. When we started this work 2.5 years ago, the idea was to influence and support the concepts behind the European health data space. So we think that if compacts emerge in the next 12 to 24 months, they are very likely to actually champion the use of the European health data space. They become an early first use case, if you like, potentially, as you get people who think, actually, I've got data, I do want to share it, I do believe in these societal benefits, and it's not an either or, both are possible, if you like.
So which types of health data could be then covered by this compact? So
potentially any type of health data and even wider data. So I started to talk about population data and demographics. It doesn't have to be strictly health data, but in the types of health data, the European health data space has a list now of potential data. So determinants of health, administrative, genetic, genomic, proteomic, person-generated data, i.e. all things like Fitbits and your Apple Watch, clinical trial information, all of these things, even biobanks and registries, all of that data is potentially within scope for a compact. But the whole point is that it's the party that has, the organization that has that data that decides to share it, and by signing a compact or agreeing a compact. So no one's being forced to do this, it's their decision to do it. And obviously what's important is the terms on which they do it. So the societal compact rules and principles, if you like.
Thank you. And what are then the key components or core components of this compact? How is it structured? How does it work?
Yeah, so and it's worth pointing out that at the RoundTable 3 level, which is where we are right now, this was a very high level set of ideas and statements. So we are in the middle now of RoundTable 6, which is deep diving into operational detail of how a compact would work. So what I'm about to explain is where we got to about a year ago. And we're in the middle, and we will publish RoundTable 6 towards the end of this year, which will have much more detail around some of the things you're asking. But in basic content for the compact was that there has to be a specific societal benefit and purpose. So, for example, if this were cancer data, you'd be saying it's in for research into, and it might be breast cancer, it might be pancreatic cancer or liver cancer, or I suppose it could be all cancer, but there has to be a specific use and purpose. What are you going to do with the data? And key to it is that the use has to be transparent.
Mm-hmm.
And
Thank
then,
you.
so other terms that in the compact would be access terms to the health data. So, for instance, privacy by design, security, those type of things. Then what governance arrangements and structure would be put in place to make sure that the compact operates properly? And the whole idea, and I think where we're going in RoundTable 6, is that we're not trying to reinvent the wheel. So where there are structures that have been used in the past and work perfectly properly, then those would be adopted. And as I said, the specific uses of the health data would be an important component of the compact. And then what adherence and monitoring arrangements would be put in place to make sure that the compact and all the signatories are working according to its terms. And then there needs to be at least an annual report, which would explain what uses have taken place and what benefits or not. In other words, it's perfectly permissible to say there was some research, but it didn't lead to anything. I mean, and because sometimes people who allow access to the data have no idea whether it's led to something positive or not, and there's no harm in explaining to people what's happened. And what I perhaps missed earlier on is to say that also signatories can be ordinary people. So we can have large numbers of people who decide to be, either through patient groups like EURORDIS or European Patients Forum, or the many hundreds of patient organizations there are that for specific conditions and diseases.
Just short question here to clarify. Did you also discuss during the roundtables, like who should govern and manage the compact?
Yes. So I think we're at the stage where we believe that it needed to be transparent and it needed to be trustworthy, so that some form of independent individuals appointed on behalf of the compact signatories would fulfill that role. And in some ways, that's back to what I said before. It's something that you see in other organizations, and if you think of sometimes how some regulatory functions work, that you have independent boards, even in the European health data space, they're envisaging that. So it will be that type of an arrangement.
Thank you. I have two last questions, one from me and one also from the audience. So now compact is an idea. What needs to happen? What would be the next step of the development of this idea of the compact?
So a big part of making it real is to obtain the trust of signatories and these multi-stakeholder group, which means that there needs to be a way of promoting the idea to civil society and a wider audience. And key to that are many of the NGOs represented in actually the roundtable. So we need to pull together a group of people and organizations that really want to do this. And I know I've mentioned trust a number of times, but an example of the scale of this challenge, it's not easy, otherwise it would have been done before, is that there was a survey of 35,000 European citizens undertaken during the pandemic by the EU Agency for Fundamental Rights. And in a rather sort of scary way, 1 in 4, up to 1 in 5 people in the EU don't trust the sharing of data of any kind with public authorities. Mm-hmm. And that demonstrates why the compact type approach can make a real contribution to building the trust that is so important for the wider use cases for the European health data space.
Thank you. But what do you think could be the biggest challenge in setting up the compact?
I think it is definitely the trust, that the point that I've just talked about. I think another challenge is this whole question of payment, whether people should be paid or organizations should be paid for the data. This is definitely one of the controversial subjects, and something that the roundtable program, so IHD, DHS, and the coalition of industry partners, they think that there's a lot more work to be done. And this is not an easy topic, because in some ways there's a generational divide. So my son is very happy to give his data away in return for a free service on an app or whatever. Whereas at my age, I'm a lot more suspicious about giving data away. It gets difficult because some people think that it's their data, it's data about them, so they own that data, and legally we can't own our own data. So there's a whole difficult topic around that for people to understand, and that what's key is control, not ownership. And back to the sort of alternative models to payment, where to get access, people make a contribution in kind to the delivery of the data, to its curation, to the systems that are used. So there's a whole variety of things. So I'm not going to pretend that's easy, because it's not, but this is all, in my view, doable. We can do this. It's worth trying to do.
And here, one question from the audience. I assume there would be different kinds of typology. Those with research purpose only, those with commercial purpose only, and those with mixed purpose. Is it so? Do you say it this way?
Yes, because the arrangements inside the compact could provide for effectively applications. So in principle, someone says, I will prepare to share my data, whatever the data is. And then a request comes in under the compact, and that request will specify what it's for: research, academic research, commercial research, and then on a case-by-case basis, the signatories to the compact, if more than one person is making data available, decide whether they agree to grant it. So yes, it's very flexible in terms of what use cases of the data are made.
And there is still a last comment or question. If you have, you mentioned the study with 25,000 citizens done during the COVID. Do you have a reference? Where could people find the study?
Yeah, we'll put that in.
Yeah, the comment
we'll
is that in general. Chat. Yeah. Okay.
We'll put that in the chat later. It might take a couple of minutes to dig that out, but yes, we do.
The chat, we will post it there. For those who don't see the chat, this means that you are in the home page of the platform, and you should go to the agenda and click to the session to actually unlock all the other functionalities. But here, still back to Bleddyn. Last question for the last final question, or maybe two. How much time do you think that this might take? When this could be a reality? And second, when people want to learn more about the compact, where should they go?
So in terms of learning more, watch out on social media and on our websites and IHD's websites, because we will publish a RoundTable 6 report, I would think, around about the end of this year or the first weeks in January. But you can always reach out to me. People can email me. My email is in the public domain. So I'm very happy if people have a real interest in this to communicate with us. So in terms of time, I feel that you can't do it within weeks for sure, because of the number of organizations. However, if just two people wanted to do this, it could happen in months. There is no reason. It's the art of the possible. Realistically, I think we're talking about 3 to 6 months to set something up for the very first one. But thereafter, once you have a template, it would be easily adapted, in my view. But with if there's a willingness, there's a way. And as a lawyer, I would always say that I think you can do this if there's a real will and wish to do it.
Super. Let's stay with this message. And we encourage you to dig deeper and follow the social media of IHD, the Digital Health Society Summit, the European Connected Health Alliance group, and also send a message if you're interested to Bleddyn at ECHAlliance.com. With this, I would like to thank you, Bleddyn, very much for this discussion and introducing us to the social compact as a way for health data sharing to the implementation of the European health data space. We finished the first block of our session for this morning, and I invite you all to join the networking and visit the virtual booths during this break. We will meet at noon Central European time. So yeah, I wish you now a nice, relaxing break, and see you soon. We will then have a keynote from Anik Fess from J&J, and we continue with the topic of the European health data space. So stay with us and see you at noon.